And so when did you take your NPTE?
So I took mine about, I want to say it's like a week before I graduated.
What were your thoughts on taking it before you graduated?
Well, you can start working sooner, so financially it's beneficial.
How was
Studying, I think it has a lot to do with your school schedule, because my school schedule the last year was purely rotation based, so I pretty much viewed it as my job to study outside of school. You gotta study for at least 4 months, 5 months, like legitimately 20 hours a week, I'd say. Have a plan to study at least 20 hours a week for at least 4 months. So if you're not able to do that, it's not a great idea to take the test early. Though at the same time, I mean, theoretically, most jobs, if you were to fail it once, I mean, you'd be able to start work at the same time if you took it afterwards and you failed it, before. So it's not that
It's
big
just
of a deal,
financially.
but it is a financial obligation when you're, usually not in the best one. But overall, I'd say that it's really about what you're comfortable doing and what you're able to commit if you take it beforehand, because you just have to be able to commit a good chunk of time outside studying, or you're not going to be successful.
Yeah. And I took mine after I graduated. I forget if it was an option to do it during and whatnot, but again, I wasn't probably in the best mental state. I was very stressed out. I probably couldn't have done school and that, so I waited till after, and I pretty much just made it my full-time job to study. I personally require a lot more study time probably than the average person, and so I pretty much just went to the gym and studied for, I think it was 3 months straight. I had my study schedule that I would do, and that's what I would do all day.
It also depends what state you're in. They have different rules from a practice standpoint. So I think New Jersey's changed, but that's where I graduated from. I was the first person in my college to take it before I graduated, which was unique for my college, and they were I feel like they were a little bit taken aback by that. But I mean, down here in Georgia, I mean, people literally do it all the time. And for me, I was getting my license for Georgia, so I was able to do it. But it's state specific for where you want to practice that you might not even be able to do that.
Yeah. And also know yourself, know your strengths and weaknesses, and if you think it's something that you can do, go for it, because then you can make a little bit more money sooner. But don't put a whole lot of pressure on yourself. It's just not worth it. You're already going to have a lot of pressure, and life changes during that time, et cetera, so forth. So it's really a personal decision what you feel is best. How did you choose your first job, and what did you look for in it?
So I interviewed at a few different spots. First job, I was really, this is not the best thing, but I was honestly, at that time, I liked the productivity bonus. Where I was from in New Jersey, I mean, there's one rotation we saw 8 people in 1 hour that I saw as I want to say it was my first rotation. So I knew I was comfortable with a higher caseload. So I actually looked for a place where I could get that. Hindsight's always 20/20, but I was looking literally how many therapists are there, how many tables are there, and that helped me make my decisions, along with the productivity bonus. That's kind of how I chose an individual location. But company-wise, which is actually much more important in hindsight, the opportunities of mentorship, having a routine and scheduled mentorship instead of just being told, we have mentorship too, is very important, because everyone's going to tell you they have mentorship. That doesn't mean they do it. It doesn't mean they follow suit with it. Onboarding schedule didn't really matter much to me, though I know that's something to look for as well. And then just probably the biggest thing though was growth opportunity within the company. That's what I looked for the most.
I interviewed as well with a couple different spots, not probably as many as you. I was looking for mentorship, really was the main thing. My thing with anything that I do, I want to be the best that I can be in that thing. And so I was at that point, I think I wanted to do a residency. I think I said I wanted to do a fellowship after that. Yeah, not doing that right now. I liked the company that we worked for because they offered that structured mentoring. So I actually, once I started, I felt like I had more than enough mentors. I think I had like 3 of them, and I could reach out to them at any point. And it was truly that like mentor-mentee relationship, whereas other like classmates, their company had said that they had mentorship and they were not getting any mentorship. And so that was kind of, I was taken aback by that, because I was like, I have more mentors than I probably even need, but it's nice to have the different perspectives. But that was partly also because I was doing the residency program as well. So I had my residency mentors. I had also an assigned senior therapist in our company who's been working for like 5+ years and has additional credentialing, et cetera, so forth. And they are paired with you the first year, and you have periodic meetings with them. And then you also have like group meetings that you go to as a new grad, new person in the company, to learn more about the company, about like treating and things like that. Just, I felt very well supported, and that was what I was looking for in a company. I wanted just the clinical growth opportunities was really more so what I was looking for. I want to say I looked at the onboarding and productivity expectations, because I didn't want to be treating a bazillion people at once. I wanted to feel comfortable and confident that I was providing the best care that I could be at that time. So I liked the slow ramp up over the 3 months. I never felt rushed or pressured to see more people. I liked the fact that if I wanted to see more people, I was compensated for that as well with the productivity bonus that Steve mentioned. And then I really, like, looking back on it, I think the people that you work for is also important, and having people that will support you and also have like similar values about like caring about the patients versus just like showing up to work, I think is helpful, and just feeling supported so you're able to do the best job that you can do, I think is really more important. And then kind of going into, what have you experienced any burnout? What is your view as like a boss on burnout in the profession, because it is pretty prevalent, I would say, just overall.
I think statistically, I'm sure this is worse now since COVID and people losing their jobs and the ramp up of travel, but I think when I was coming out of school, it was well over half of PTs switched jobs within their first year. I'm pretty confident that's higher over the past 2 years, just because of, nationwide, every job is having an increase in turnover and things like that. And not even specifically in our clinics or not, it's definitely higher, whether it's my classmates or people we see, where a lot of times it's a lack of passion and purpose is really common. Maybe the setting that you thought you wanted to do forever, you realize it's not the setting that you wanted at all. Kind of tying back to that previous question, is it what you expected? You have this expectation, it's not it. So part of it's just the nature of learning what you're actually looking for, and it's very tough to do that. Part of it, I think, is the support around you. Part of it's your level of really just knowing that it's okay. In some cases it's okay if people are actually just looking for a job and they don't understand that emotional burden and what toll it can take on them. Part of it might be wanting more opportunities for growth, but not knowing it. Part of it might be taking growth opportunities and not knowing that you don't want it. So there's definitely some people I know, either from my class, my sister class, where they've been directors and then on the back end realize they don't want to be it. But it can be so many different things. It could be dealing with difficult patients where you're stressed out. There's so many ways that PTs can be quote unquote burnt out. It's really challenging to see what it is, and a lot of times it's really challenging because they don't know that it's happening to them. They're like, yeah, I'm fine, until you are like, I need to quit my job, I want to change settings, whatever it is, and at that point it's probably already too late. So
yeah, I definitely think staying on top of it and like looking for signs is important, and then addressing the things that are causing it. So I know with me, I probably would say I personally just like fluctuate between like burnout and like than overcompensating and kind of just going back and forth. And I always work my way back up towards that just because that is part of my personality and something that I'm working on. I know clinically with residency, it was a lot, but it definitely helped me be more confident in my treating. So like I said before, so that kind of contributed to the burnout, but also helped me more sustainably, like long term in the career. I also found, for me personally, I felt like PT was somewhat reactive instead of proactive. And to address that, I kind of went online. And so that was kind of part of the reason why I took that direction with my career, because I wanted to prevent the actual injuries from occurring and get people moving better, help people learn about their bodies more, versus just coming because like a doctor referred them because they got injured, even though it might have been something either that they could prevent or like reduced the severity of. And like getting in early access of care and things like that. So that was kind of why I went that route, partly because I noticed that passion shift and that lack of support in that PT field specifically.
I think that ties into probably the number one, if you want to be very general, cause for burnout really is people kind of like, we talk about this in a lot of my management meetings and mentoring people and helping them grow. It's really about a why. In PT school, it's learn this, what is this, how does this work, and then you just never really reflect on why you want to do it. What setting do you want to be in? No one ever asks why you want to do it. And then you do it, and it's what, and how often are you looking back and saying, this is why I love what I do? Like people always ask, why did you go into the profession? But it's never, why do you still love what you do? And a lot of people lose their why, and it's not tied into what they're doing day in, day out, so they lose their passion for it. And all these things that are challenges, right? Depending on what your perspective is, it's a growth opportunity or it's something that makes you hate your job, where you can grow more by patients being challenging, right? Having difficult conversations with them. Hey, I realized like I used to really struggle with this, right? No, instead it's just, yeah, I hate it when. And that mentality and that losing your purpose can really lead into the burnout.
Yeah, I definitely think that's really important, just in anything that you do, and also with your career.
And that's where you went into what you do, because that was what you realized, that's actually my why for this field. It's not really this. And why can change, and it's okay that it does, but it's about realizing it and seeing what steps you want to do to address it.
Definitely. Kind of going a little bit into residency, like I had mentioned, we both did a residency. So did you think it was worth the time and the money? And why? Yeah.
In fairness, for some people, you have a family or, and kids, and it can be very challenging to find the time to devote what you need to get everything out of it. I remember probably my first month and my last month, they said, you get in what you put out, so it's very easy to go through the motions and just get it done, and it might not be as valuable for you, and that definitely held true at times where I was, struggling with different things. It showed with my work and my level of commitment to reading the articles and everything, but I mean, that's just natural, whether it's your job or your family, you're never gonna have it just be at max capacity at all times, but definitely worth it. With our company, it was $5,000 pretty much pulled out of your salary over the course of a year or two.
Yeah, you can basically choose between 1 or 2 year.
Yeah, depending on how you want to do it. I think that was lower than most, and that was very helpful. I think there's other ones where it was like $20,000 it would have been off or whatnot, and that's definitely a bigger hit. But I can promise you, from a $5,000 standpoint,
it's totally worth it.
I've made so much more back than that just off of the knowledge gained and level of comfort with patients. I mean, either starting my business and them saying that's the person I'm going to. I don't care, doctor, that you're referring them over there. I'm going back to them. So definitely very worthwhile financially and work-life balance-wise. I mean, I just screw around at work all day, is what I say, because I just know the stuff so much easier. I don't have to think as hard, and it just allows you to be yourself a lot more at work and that's really what a lot of people struggle with in their first year, is they have to think so hard at work. They're just drained by the time they get out of work. They just have no mental energy for anything else and enjoying life. And it's definitely a sacrifice, but on the back end, the reward is definitely there.
Yeah.
But, reflecting on it a little bit more, I think it was very helpful in terms of really every single goal that I wanted in physical therapy. I mean, whether it's the ability to help others is, one of the reasons I like having more of a management leadership role now. And even a lot of those principles apply. Work-life balance, I got better at because of that. Dealing with, difficult patients, I got better at that. And maybe that's a difficult conversation at work as well. Building relationships with patients, and maybe that's helping build relationships with others. And those are all the tangible things that you think about, but all of that improved with the residency as well. But overall, I'd say the biggest thing was just being able to be myself at work more.
I know with me, I agree, it was completely worth it. Just with the company, how we're set up, based on the fact that you improve your clinical decision making, you improve efficiency, so therefore it then improves your work-life balance. So you don't have to take home notes because you get them done during the day, because you're able to think faster, document faster, interact with people, and actually have a conversation with them while you're doing all of these things, because you don't have to think so hard. So it just makes your day more enjoyable. And like I said before, I want to be the best that I can be at whatever I choose to do, and that allowed me to get there, or continue to get there, because you always are improving. And then I know, talking with some of my friends from PT school and things like that, they struggled a bit. And it's hard, residency's hard, transitioning to working is hard, but I could tell the difference doing the residency and how it made me more comfortable in the clinic, less questioning of what's happening with this person, I don't know, and just a lot of extra stress because of that. So it just made a lot of things better, and more than what you think. So 100% worth it. And then with the productivity bonus structure, you're able to see more people more comfortably,
if you want to,
and still provide the quality of care. And so you can make back that $5,000 pretty in a reasonable amount of time.
Yeah, and you're going to be stressed your first year no matter what. So it's really just what is your stressor? What do you want it to be? Do you want it to be studying more outside of work, or would you rather be so drained from your thoughts that you're not so confident with what you're doing that you can't do things outside of work and enjoy that time? So it really isn't as much of a pull as you realize, because if you do it in your first year out, because you're going to be in a bad spot no matter what from a work-life balance standpoint, very frequently, just because the level of mental energy that you're spending.
And then just as a resident, you don't really understand the growth that you're getting. You just feel like you're constantly struggling and you're swimming, and you're just making it happen. As a residency mentor, the growth that we see is a lot.
Yep.
From beginning to end, you're just holy crap, this person came in not really knowing what to do, asking all these questions, and now I'm just sitting back and watching them, and they're doing a great job. And it's just very rewarding on that standpoint. And so seeing it from both ends was very interesting for me as well.
You just can't process it till it's done.
Yeah. And then what about fellowship? Have you done fellowship? Do you think it's worth it? What career path, I guess, would you say it would be worth it for?
I would say if you want to go into a teaching role down the line, it's definitely worth it. I think the main reason people don't do fellowship is you do the residency first, and I mean you just know what that commitment took, and it's just hard to swallow that pill again, because it really takes years to fully appreciate what you learned. That's just a tough pill to swallow. It's usually a lot harder from a resource standpoint, because there might be more travel involved, because the amount of resources there are is not as plentiful. So I've not done the fellowship. I will not do the fellowship. There's people I know that, it's really about why you would do it. And it's not just I want to learn more. It needs to be what is to make it probably most valuable for most people is what's your goal in 3 to 10 years.
Yeah.
And it should match that.
I pretty much agree with everything he said. It's really if you're going into teaching, and that's really the only thing that I could probably think of why you would do it. But obviously we are slightly biased because we both did not do a a fellowship. Talking to fellows and people who have done fellowships, because we interact with them, like with the continuing education, the fellows help with the residency teaching. They know a lot of stuff, and it's very impressive.
Yep.
So it depends on what your goals are, really. So what is your perspective on, is school debt worth it?
It's a challenging question to answer because I'd make the argument that it should be if you go in for the right purposes. There's definitely some PTs that go into physical therapy and they think it's just a job. They don't have to worry about it. They don't understand how hard the schooling is. They don't understand, some of the challenges we discussed today about bringing patients home with you, not literally, hopefully, kind of creepy. But metaphorically, in terms of that mental burden, how stressful it can be learning a new documentation system, handling your patients, their whole spectrum of care, dealing with the insurance companies and the challenges that comes with. There's a lot of things that you can make them as negative as you want to, but that really just ties into, do you have a passion for serving your community, whoever your community, whether it's online, or literally just a CrossFit gym, and the athlete, or is it just the average person that's just dealing with different issues for whatever reason, whether it's a neuro patient, a dizziness patient, a pediatrics, really it's all about whether or not you have a purpose and a why in your life. It's not some job you're going to start out at 6 figures working 30 hours a week and it's a breeze.
No one's getting into it because of the money.
Yeah, if you go into it because of the money, you're going to be disappointed. And it's not because it's not a good career financially for people. It's because there's a lot of other things that come along with it. And it's just not a good reason to just be a physical therapist. It's a great way to be burnt out, not care about what you do as much, feel like you're punching the clock. There has to be something of interest and that's you're passionate about, or else you're going to be 5 years in just looking at why the heck did I spend all this money on this and wondering if you wish you did something else.
And I personally kind of go back and forth sometimes about if it was worth it, because there are definitely things. I enjoy the clinic side of things, don't get me wrong. I enjoy the mentoring side of things as well. But then you look at what I do online and it's like, do I really need a physical therapy education for this? It helps, but it's not needed. So I go back and forth about it, like, would I be satisfied if I only did that? And then part of me goes, not really, because I wouldn't be the best that I could be at it. So that kind of leads me towards yes. Financially, it is a lot of stress. It's a lot of money to pay back. Just go to the cheapest school that you can. That's good. I did not do that, and that is one regret that I probably have. Like, I went out of state. I don't know why, but that was dumb. Very dumb.
You won't learn as much in PT school as you think, in terms of where you'll feel fulfilled in terms of career direction and things like that. Going to a better school doesn't really mean all that much.
Yeah. Like, I looked at the rankings and it doesn't mean anything. That's more research based, not like the education based. And so just go with where is cheapest to either live or work or whatever.
Works for your family as well.
There's a ton of different factors that you have to consider, and it's the individual decision. But don't just go to somewhere because of the rankings.
It's a better school online.
Yeah. Ignore that part.
Yeah.
So I guess yes, because it allows me to do what I do now and be the best that I can be at it and continue to grow, and it has provided me the tools to be able to do that. But it really depends for a lot of people, and it's really finding that purpose and your why, I think, is really the main thing. And so if you know that, then you can determine if it's going to be worth it for you. And on that note, I think that it's a good thing to end on.
Yeah.
So if you did find this helpful, let us know in the comments below. Please feel free to reach out. I personally have, and I know Steve has as well, hopped on calls with people who are interested in getting into the field, current students, people like looking into trying to figure out what they want in a first job, et cetera, so forth. So honestly, feel free to reach out.
Well, good deal.
Yeah. Cool beans. Walks. Time for walks.